Hello friends, once again welcome to my channel Nursing Medicos. Today we'll discuss 50 important point care of newborn. Before that, you subscribe my YouTube channel and ring the bell icon so that you can get my all videos notification. First one, sometimes the skin of our baby arm and legs will develop a pattern that looks sort of like a marble. We can see this is occur when the less blood supply. This is called mottling. You can see in this picture like a marble. Next one, with every newborn, respiratory evaluation is the necessary because this is the highest priority in newborn care. In case of newborn, this is the highest priority. Next, the Silverman-Anderson index can assess respiratory distress and its varying degrees. Next one, lanugo or the fine drawny hair that covers the shoulders, arm, back of the newborn. That is called lanugo. You can see there in this picture. Next, there are 5 criteria to evaluate the newborn: chest movement, intercostal retraction, Gifford retraction, dilatation, and expiratory grunt. Next one, the newborn height and weight can determine their maturity and establish a baseline data of their height and weight. The newborn height and weight determine maturity. Tonic neck reflex. A newborn head of one side will cause the extremities to on the side extend while the opposite extremities contract or flex. We can see in this picture. This is also called boxer reflex. This is next one. The appearance of sunside eyes in which the sclera is visible above the iris result from cranial nerve and maybe indicate increased intracranial pressure. A respiratory rate of 40 to 60 breaths per minute is normal for a neonate. Next one is neonate of mother with diabetic are at the risk of macrosomnia as a result of combination of increased supply of maternal glucose, increased fetal insulin, along with this is the next one. The temperature of neonate receive phototherapy should be monitored at least every 2 to 4 hours because of the risk of hyperthermia with phototherapy. The next one is bulging frontally are the sign of increased intracranial pressure, ICP. This bulging frontally. Next one we'll see. We can see in this picture a white pinpoint that is melena can be found some newborns, mainly on cheeks or bridge of the nose, that disappear by 2 to 4 weeks of the age. This is we can see melia in this picture. Next one is cutis marmota is bluish molding of the skin. This is the bluish discoloration of the skin. Next one is greenish brown stool at 48 hours are normal and indicate that the neonate is eliminating formula instead of meconium. Next one we will see normal neonatal blood pressure reading is 60 by 40 mm Hg to 90 by 45 mm Hg. This is the normal. Then normal neonatal apical heart rate is 120 to 160 beat per minute. Normal respiration 30 to 60 breath per minute. A Apgar score 8 to 10 indicate neonate is in distress. A score below 8 indicate the necessity measured by needed. Means 8 to 10 is there is no distress. Next one is the neonatal skull has two fontanelle. One is diamond shape, anterior fontanelle and posterior is triangular. Anterior closed in 1.5 year and posterior, that is triangular, closed in 1.5 month. Next one, neonates may have polydactyl more than 5 digits on an extremity and syndactyl 2 or more digits fused together. This is polydactyl and syndactyl. The next one is port wine stain is a capillary angioma located below the dermis and it commonly. The next is a strawberry hemangioma is a capillary angioma located in the dermal subdermal skin layer, indicated by the rough rise sharply at birthmark. Neonate temperature is 99 degree Fahrenheit, 37.2 degree centigrade at the birth. Administration of judovirin to human immunodeficiency virus positive pregnant women significantly reduce the risk of transmission of HIV. Next is a mother can transmit HIV to the child transplacentally at various gestational age through maternal blood, fluid and through the breast milk. Bronchopulmonary dysplasia is complication common in neonates who receive prolonged mechanical ventilation at the birth. This is bronchopulmonary. Next one is this reflex when you place your newborn on his stomach. He will usually draw his knee up under his belly in a fetal position. We can see baby is in fetal position. Syncophantally and no urine output in first 24 hours of life are sign of poor hydration. Hepatitis B immunoglobulin should be given within 12 hours. Next one is eye prophylaxis is administered to a neonate immediately or soon after birth to prevent ophthalmia neonatum. The next one is nasal flaring and audible grunt are sign of respiratory distress in neonate. Medications such as phenobarbital should be given as needed to neonate experiencing drug withdrawal. Macrocephaly is usually the result of congenital cytomegalovirus or congenital rubella virus. Next is convection. Heat loss is flow of heat from body surface to cooler area. Conduction is the loss of heat from the body surface to cooler surface in direct contact. This is conduction. Evaporation is the loss of heat that occurs when a liquid is converted to a vapor. This is evaporation. Radiation is the loss of heat from the body surface to cooler solid surface, not in direct contact but in relative proximity, which is radiation. Next, hyperbilirubinemia is the cause almost exclusively by unconjugated bilirubin. Next one is neonates of Rs negative mother tend to have hyperbilirubinemia. In case of Rs negative mother, low APGAR score may indicate a risk of hyperbilirubinemia. Transmission of group B beta hemolytic streptococci to the fetus result in respiratory distress that can rapidly lead to septic shock. E. coli is the second most common cause of neonatal sepsis. Hyperglycemia in neonates feel lethargy, diaphoresis, the glucose below 40. The presence of hospodactyl glycerol in lung maturity. Chronic fetal distress tend to increase lung maturity. Conjunctival hemorrhage are commonly seen in neonates secondary to the cranial pressure applied during the birth process. An absent motoreflex, lethargy or seizures are symptoms of bilirubin encephalopathy which can be life-threatening. Coronary atresia is caused by protrusion of bone or membrane. Meconium aspiration is the meconium aspiration into the lung during the birth. Thanks for watching. Subscribe my YouTube channel, like and share. Ring the bell icon.